So today, House Speaker Nancy Pelosi again came out with a notion that insuring 47 million people with a brand new government bureaucracy won't cost anything. Here's Speaker Pelosi.
This is legislation that will not increase the deficit. Half of the funds for the bill will come from savings, others from a revenue stream. I hope that we can change that percentage, that we have much more coming from savings. In fact, I believe that all the cost of the health care reform bill can come from squeezing more savings out of the system.
Well, Congressman Bill Cassidy, who is also a medical doctor, joins us now from Washington. So, Dr. Cassidy, it's all free. This new bureaucracy that's going to insure $47 million is going to be completely free.
Well, the CBO disagrees. The CBO says it will cost $1.6 trillion over the next 10 years. But, you know, it actually is $1.6 trillion first 5 years. Out. It's actually $1.6 trillion over 5 years, or $1 trillion, give or take.
But how could anybody possibly buy that? I mean, we first heard it, by my reckoning, we first heard it from Lawrence, I was going to say Lawrence Lindsay, from Lawrence Summers, Larry Summers, the president's chief economic advisor. He suggested that we might save enough money in order to pay for this. Now, the fact is that we do have, for the moment, it might not last much longer, but a free market system in insurance companies. They're already looking for ways to save. You don't put that savings into a government bureaucracy. The government bureaucracy is going to cost money to build, right?
Absolutely. And let's face it, everybody is so distrustful of insurance companies, the average consumer, that the advocates for this are playing upon this. They're saying, oh, we need competition to the private companies. But what they're really saying is that we're going to replace the private bureaucracy with the public bureaucracy. Now, there's nothing innovative about this except that we're nationalizing the health insurance industry, or maybe that we're politicizing it, but the innovation is not there.
Well, let me just ask you something, because I've heard this from Democrats saying that the reason we need a new public bureaucracy, a government-run insurance company, is because there's no competition. If there was no competition among the more than 1,000 private health insurers, wouldn't that be against the law? Isn't there something against collusion to set prices?
Well, technically, there are some exemptions for insurance company, but let's look at where there is already a public option, if you will, which is Medicare for the over 65. There are very, very few private insurance companies engaged in the over 65 market. So I think we see, if you want to talk about no competition, concentration of a payer, look at the Medicare program. Again, all this does is substitute a public government bureaucracy for the private insurance company, with the public bureaucracy being both the referee and the player at the same time.
All right, and if you believe that a government insurance company could pay for itself, look at Medicare, whose expenses just keep growing and growing and growing. It's one of the biggest reasons that Social Security might go bankrupt. Now, let me ask about this 1,000-page document that Democrats came out with earlier in the week that include all these tax measures and everything. There's a little paragraph that was found by the Investor's Business Daily today in there that says the individual, and I'm quoting from the document, the individual health insurance issuer does not enroll any individual in coverage on or after the first day of the year this legislation becomes law. Now, that has suggested to some that this document wants to outlaw private insurance after the new government insurance company comes into existence. Do you agree?
Yes, I do agree. And there's also some ways that it does it more subtly. But I think the critical issue here is that this is very payer-centric. It doesn't give that patient a choice. It says you must do this. It's very payer-centric, not patient-centric. As it turns out, things that do save money when you make them patient-centric are HSAs. HSAs are not allowed in this bill.
Hold on a second, guys. That's the health savings accounts, and explain how they work.
Health savings account is with pre-tax dollars. An employer or a patient, if you will, an employee, funds their own savings account. And they will pay cash for the first, say, $5,000 worth of health that they consume. A good example is a patient was telling me the other day, his other doctor wrote him for a prescription for a pill that cost $159. He said, "Doctor, I got an HSA. I'm paying for this myself. Can you write me something cheaper? The doc wrote for a generic that cost him $20. Because it was patient-centric, because the patient was, in a sense, spending his own money, he pursued a more value-conscious decision. This public insurance plan insulates patients from the payer-centric model. Again, it's payer-centric. The patient-centric HSA has been shown to decrease costs by 30%. Recent article in Health Affairs by economists from Harvard that pointed that out in the real world. Saves money. % not allowed in this bill.
All right, doctor, we got to run. You got to run. But I got to ask one final question. You are a medical doctor. You keep hearing time and again from Democrats in the administration that our system is terrible. We have awful health care. You know, I've compared it to systems abroad. It's pretty good in comparison to the others. You got problems, but don't you think we got a pretty good system? We shouldn't mess around with something like we have right now?
We have a very good system, and granted, we need reform of some sort, but we don't need to nationalize the insurance company. Many of the, if you will, unfavorable comparisons are because of lifestyle choices. You'll never have enough insurance to keep somebody from the lifestyle choice of too much alcohol or too much obesity. And so when they give you that, ask them how many of those discrepancies are due to lifestyle choices. It is the lion's share of those differences.
Dr. and Representative Bill Cassidy, good to see you, sir. Thanks for coming in. Appreciate it. And we welcome back